Okay, Doug, thank you for doing this video for us. I always ask our patients if they're willing to share their experiences with us, and I appreciate you doing that.
Sure.
Tell me a little bit about yours.
So I've been snoring very heavily for forever, really. My weight would go up, my weight would go down, and it just seemed like no matter what happened, no matter what I did, I would always snore. And I've tried different devices, things that you boil and mold it to your teeth and help keep your mouth open. I've tried jaw straps, I've tried things that you insert into your nose, and all of that stuff. It's just none of it works whatsoever, at least for me. I either end up ripping it off in the night, or it just doesn't work. And so a couple of years ago I started considering some sort of a surgical solution, and really up until recently it's become problematic. My wife is like, you got to get this done, you got to get this done. And that's when I came to see Dr. Gilbert, and the surgery went exactly as planned. I was prepared for everything. They told me every step along the way what was going to happen. What I appreciated most about Dr. Gilbert and the staff was that they prepared me for what was going to happen. They tried the least invasive solution first, and then we escalated into the point where we knew that surgery was kind of the best option for me. We had the surgery where my uvula was removed. I had correction of a deviated septum. I had a reduction of turbinates within my nose, which I never knew were a thing, but apparently they are. And now we're a few months post-surgery, and the first 2 weeks were very uncomfortable. The first really, excuse me, the first probably 5 days were painful, but they were more uncomfortable. I could still talk, but it was just uncomfortable. And now that we're completely out of post-surgery and I'm completely healed, my wife says that it's an 80% improvement in my snoring. I get better sleep, I can breathe better, and my wife is happier, so it was well worth the investment.
That's really awesome to hear. A lot of times people have unrealistic expectations of their recovery. Would you say you had a good sense for the recovery process before you had your surgery?
Absolutely. I knew exactly what to expect. I knew there was going to be pain. You can't go into surgery in the back of your throat and in your nose and not expect that there's going to be pain. Every time you swallow, it's a reminder that you had surgery. I knew that going into it, but the benefit was far outweighed the pain that was going to be caused.
If I recall, the reason you came in was really not your concern, it was your wife's concern.
Yes, right? Absolutely.
And now that is improved, but you've also noticed an improvement in your own sleep since this, which happens to be kind of anecdotal for you.
Yeah. Tell
us about that.
Yeah, so I never really noticed how poorly I slept until I got a good night of sleep. And now I sleep all the way, sorry, I sleep all the way through the night now, unless my wife, bumps me or nudges me for some reason, but I sleep all the way through the night, and I feel like I get a better night's sleep every night.
Sleep is actually invigorating, isn't it?
Yeah.
I mean, it makes you feel different.
Yeah.
Well, listen, I'm so happy for you. And you know what they say? Happy wife.
Happy life. It's absolutely true.
Have a good one, okay?
Thank you. Thank you.